Hello and welcome everybody to the Debrief. My name is Kendal Bailey. I am very excited to be joined today with Dr. Stephan Davis, who is currently the Executive Director of Policy, Leadership, and D&P programs at Georgetown University. And I will say, overall, just an amazing human who is really expanding belonging and inclusivity for both nurses and nurse leaders across the healthcare institutions. He is a fellow for the National League of Nursing for Nursing Education, as well as a fellow for the American Academy of Nursing. And I will say, you are quoted as saying, for trying to make a space for difference. So, Dr. Davis, it is wonderful to have you here today. Thank you.
Thank you for having me. I'm excited.
Well, I was excited as Dr. Davis and I were talking earlier about where he's at and what he's doing. He's currently in DC, and I will say a lot of your work, I see you doing amazing work for policy and looking at ways that we can expand both the nursing profession and nursing leadership. But how did you get into nursing? How did you get to that path where now you've grown as a nurse and a nurse leader?
Yeah, originally I was actually a jazz performance major. So I left St. Louis, Missouri, where I'm originally from, and then moved to New York City to study at the New School. And when I was there, I realized that I didn't necessarily want to continue playing saxophone and studying music academically. I still play and write music to this day, but didn't want to study it academically. And when I began taking courses on philosophy and the social sciences and humanities, I ended up discovering this real passion for addressing inequity and disparities, whether that be related to normal, sort of everyday social problems or societal problems and challenges, but also in particular related to healthcare. And so I thought I was either going to pursue social work or nursing, and landed on nursing, and thought that initially I was probably going to land in the behavioral health space, but it was my courses in healthcare leadership and policy when I was a nursing student at University of Maryland School of Nursing that led me into the healthcare administration realm and studying executive nursing leadership and policy. So that's a little bit about my journey and how I ended up landing in the executive healthcare leadership space.
It's amazing, I will say, as we continue to ask these questions, and I feel like I say this every single time. I love how people enter nursing, and so many times it's just this non-traditional pathway, especially with your passion for music and what you've been doing. And you're a Yale alum, right, in regards to your experience for your doctoral education, correct?
Yes.
And I will say, I was watching one of your keynote presentations, and what I really liked about it is you were talking about maybe some of your own personal perspectives as you've been growing in the nursing career have really shaped the work that you're doing now. Do you feel like that really has been your driving force, what you have seen as a nurse and have been progressing as a nursing student that has led you to the work that you're doing today?
Yes, when I was a student at University of Maryland, I actually came across some cases of discrimination against the LGBTQ community. And a few of those cases ended up inspiring a lot of my work in diversity, equity, and inclusion ultimately. And one of them, for example, Tyra Hunter, a trans woman here in DC who was involved in a car accident. And when EMS came to rescue her, unfortunately, when they removed her clothing, they discovered that she was not assigned female at birth and stopped providing care. And in fact, began making fun of her instead of providing care. And it was only when bystanders ended up reaching out to EMS supervisors, and the supervisors demanded that they resume care, that she was then taken to DC General Hospital, where she ended up receiving substandard care and then ultimately died. And it was found upon investigation that had she received prompt and timely evidence-based care, that she actually would have had a great likelihood of survival. And so it's cases like that that affected members of the LGBTQ community that really led me to want to do work that focused on creating spaces for everyone. And that led to my journey in helping hospitals achieve leadership designation with the Human Rights Campaign for Healthcare Equality, and then more broadly, other work focused on inclusion and belonging for both members of the healthcare workforce and also for the patients that we serve.
as you talk about this story, I have to admit, like, there's that immediate reaction of me that makes me feel like there's no way that we're still in that healthcare environment, right? That there's no way that we would, look at a human and look at somebody who is in need of immediate medical care and change that based off of who they are. But it sounds like this seems to be a pretty common thread in our healthcare communities. This is not a new conversation. How do you think we are getting to this place where we're still having all of these inequities in the care that we're providing for our very diverse patient populations? Is it lack of education or just awareness? What do you think is really the driving factor for that?
Yeah, well, Tyra Hunter's story, that's, 20 plus years ago. So I would like to think that we have evolved and that things are different than they were then. I do obviously recognize that we still face challenges. One of the things that I think that we really need to focus on, not only in the profession, but also just looking at healthcare more broadly, is focusing on our principles of bioethics. Because it's not always the case that we know exactly what should be done in a particular situation. We may not know what's right. However, when we really consider the bioethics principles, looking at autonomy, beneficence, so are we doing good rather than harming the patient? So we want to benefit the patient. And then non-maleficence, first do no harm, is really based on that principle in the Hippocratic Oath. And then justice. Are we doing for one patient what we would do for another? Are we treating patients consistently? And so when you think about those four bioethics principles, to me, they're guideposts for how we should be engaging with every patient that we see, every member of the healthcare workforce, every family member, every member of our community. And so, I think that keeping those top of mind, in addition to also knowing our own personal values and ethics, is paramount for delivering equitable and inclusive care.
Do you think that we're preparing nursing students, though, to be able to understand those bioethics and understand those values and bring that into the practice every single day? Or do you feel like we still have a gap in that translation for the new generation of nurses?
Yeah, I would say that, in some institutions, there's a great focus on that. So at Georgetown, as a Jesuit institution, we place a high degree of focus on ethics and the bioethics principles. So I will say with confidence that our graduates leave our programs with a very deep understanding of that and a lot of reflection that they engage in focused on ethical principles. Whether that's universal or not, I think that we have some work to do within the profession nationally as we think about nursing education. But this is something that should be threaded throughout as we think about the AACN essentials and the new directions for nursing education.
I think the big thing here is so many people think they need to get creative and new in how they approach inclusivity and belonging, that there has to be this brand new model for what it means to develop and grow this as a mission at the organizational level. But what I love is that you just leveraged the bioethics as a standard, which we know and we discuss very commonly in nursing curriculum. And so it seems like really it's not coming up with this big expansive new process. It really is leading into what we know as the tenets of our nursing profession. And that seems to be really the driver that you focused into. No, I think that's a wonderful perspective. And I will say, especially the work that you've posted around Georgetown University, I'm just amazed at what your graduates are doing at the national and international level, expanding that scope and expanding that inclusivity and belonging that I think is very much ingrained in your program. I think though, as I look at this conversation and I want to be reflective in myself in the fact that I, am sometimes missing that awareness and I have those implicit biases. And obviously in the community, there's a lot of polarizing thoughts and conversations. So how, as a nurse leader and a leader in academics, how are you engaging your students to have these sometimes very polarizing conversations to keep ingraining those bioethics and those standards?
Yeah, I think that's incredibly important. And I think even more important in the moment that we find ourselves in now. So understanding and appreciating difference in perspectives. And, one of the books that I love in leadership and management is The 7 Habits of Highly Effective People. And one of the habits is seek first to understand and then to be understood. So getting in the habit of trying to understand someone else's perspective, their point of view, even if you don't agree with it, and maybe you're never going to budge on your position, but to be able to at least entertain their ideas and consider what they're proposing or their perspective, I think is incredibly important. The other thing is that oftentimes when we listen to other people's stories, we can likely find some areas of agreement, some areas of common ground. And that's so important for us to be engaging in conversation across areas of difference, across areas of polarization, because in the end, we do share at least our humanity. And understanding that shared humanity is critical for us to advance care and healthcare for everyone.
I really like that conversation of being able to seek and understand and look at the differences around you so that way you can have a greater understanding. Do you feel like, though, that maybe there's a gap in what we find even within our nursing programs to support that diversity, right? We know it's harder for certain demographics of students to get into nursing school or progress through. So as nursing academic programs, are there any strategies that you recommend to help increase that diversity and belonging amongst the nursing population that better reflects what we see in the healthcare community? Are there direct approaches that you've seen that are effective for that?
Yes, I think that starting early with various populations, so getting embedded with your community, going to local elementary schools, junior high schools, and high schools, not waiting until students are in college to expose them to nursing and the health professions. That's critically important. So some health systems are doing that better than others, but that's really, really important work. And creating pathways that make sense for people where we meet them where they are and then take them wherever they want to go. So, for example, looking at bridge programs for RN to BSN or RN to MS programs. Those are critically important as we think about educating advanced level nursing practitioners, but also specialists in various areas, and then creating seamless pathways for people to advance to postmaster's D&P program, or PhD, wherever people want to go, but really making sure that that process is seamless for academic progression, and that we're really encouraging people to take advantage of every opportunity to leverage those academic programs for their benefit and their career progression.
Well, and I love now, especially as they look at nursing as the inclusion for STEM, right? And STEM really being a major conversation now in earlier education in K through 12, like you said, so we can expand that awareness to entry into the nursing profession. But a lot of these programs are costly or take time or resources. And at a national level right now, there is a lot of reduction in support for programs around diversity and inclusion. How are you seeing the landscape right now as these programs might be removed from institutions? How are the conversations still going to keep these programs alive or support those principles and the expansion of inclusivity and belonging work?
Yeah, well, I can't necessarily speak to what's happening at other institutions, but I know at Georgetown, we remain deeply committed to our mission, which we were founded upon the idea of educating people of different faiths, different cultures, different backgrounds. And although we are grounded in our Jesuit tradition and we are a Catholic institution, we welcome people of all religious beliefs, all faith traditions, all cultures, all ways of life. And that's really crucial to who we are as an institution. And so I do believe that there are going to be institutions that stay on their mission-driven path related to this work. And there are going to be others that, back away from it. So I think that it just depends on the institution's commitment, whether they're able to continue to advance that work, obviously understanding the changing landscape, but still remaining true to the core mission of the organization.
Well, and I will say, it seems like you're expanding a lot of that mission work, even from the national policy perspective. It seems like you are very included in the DC community. You have a lot of connections at the national level for the National League for Nursing and the American Academy of Nursing. Do you see any policy work at the national level to help support these programs, or do you see conversations that are happening around how we can continue to prepare our nursing community for the diverse patient populations they're going to be working with?
Yeah, I think there are a lot of policy ideas. I think that right now, as we think about what's happening in the landscape, obviously we want to make sure that we're continuing to fund nursing education opportunities for everyone. So I think that the conversation is really expanding now to, we're not just looking at race or gender as you think about various programs, but how do we really improve health for all people? How do we prepare a workforce that comes from all different backgrounds. So I think that it's an evolution as we look at what some might say was a very limited scope of some diversity programs. And that's really not what diversity programs were supposed to be about. But what ended up being actualized in some institutions was a more limited scope. And I think that now, as we're talking about the policy discussion nationally, it's how do we expand that? How do we look at programs for all members of our community, all segments of the population, including rural healthcare? So, it might not be about, race or gender all the time in terms of access to healthcare or various identities. It might be geographical access or looking at economic barriers. So there are a number of different ways that we can look at expanding access to both nursing education, but also to healthcare delivery.
Well, and I like that piece as you talk about expanding education, right? The more that we know and we understand, as you spoke of earlier, about the communities that we're engaging with. Now, I will say, right, as a simulation addict and love and lifelong learner, I think that simulation can be a very powerful tool. Do you find, especially the story you talked about earlier that sparked your interest with the case studies that you were reviewing, do you find that simulation or having more case study approaches in education help increase that awareness and the understanding of what our various communities are? Have you seen that approach to be successful?
Yes, I think that simulation is an excellent approach in education to prepare our students for various scenarios that they might encounter. So when I was leading a Master of Health Administration program at University of North Texas, we created a video-based simulation that was called Simulating Discrimination, a Safe Place to Learn the Harsh Realities of Healthcare. In that simulation, we had a patient requesting a different team member specifically because of their race. And so this was an example of patient-driven discrimination. And then our students were faced with the decision of whether or not to honor the patient's request. And so there was a lot of debate in class about whether to uphold the patient's request or to honor the request, or why you would not honor the patient's request. And there are other health systems that have actually created algorithms. And there was a journal article published about an algorithm for looking at how you would navigate those types of decisions. For instance, if you're in a life-threatening situation in terms of the severity of the patient's illness, and they're saying that they don't want a particular provider to provide life-saving treatment, and you have another provider available, in that circumstance for life-saving treatment, you probably would honor the request, move forward, and then have a discussion and debrief on that later. Whereas if this is routine care delivery, or if you don't have someone available who would meet that patient's request needs or preferences, then you would have to have that conversation in a different way. So really explaining the organization's commitment to inclusion and the fact that the patient obviously has choice in where they seek care. And that's important to emphasize, but really upholding that we value having diverse team members in our organization. That's paramount. And then looking at those very isolated instances where it might be ethically appropriate to honor the patient's requests.
I like that a lot because I love simulation. I think there's a very powerful tool, and I'm so glad that you and I can agree on that perspective. But as I'm writing sims, I will say, right, I have my concerns about potentially continuing with stereotypes or generalizations that I don't want in simulations. I will say, especially as I've been using like maybe even AI and large language models to help develop simulation content and get the creativity going, I will say I find in a lot of that AI and human language model, there's a lot of like embedded stereotypes and biases for many of our communities. Are there certain resources educators can look at or should be looking for to help bring that to their simulations or to the content or their curricular approaches in class? Where really can they go so that way they can have that like common thread of appropriate information as they're expanding this in their curricula?
Yeah, I think that there certainly are resources, but I would say there's nothing better than just running simulations by a diverse group of individuals. So getting together with colleagues who see issues and have different lived experiences and coming together and reviewing that type of material before you introduce it to students, and then even debriefing with students after you go through a simulation the first time and asking them for their honest feedback. I think that that's critically important. So, I think that obviously there's a lot of advantages of using AI and leveraging the technology and the advances that we're seeing so rapidly. At the same time, you've identified that there are some inherent biases in these platforms, and not always even some of the traditional things that we think about. I was recently reading about a concern that ChatGPT has a positivity bias, that some people have been identifying, that it's over enthusiastic about any prompt that you might enter into the system. So when you think about that, whether it's positivity bias or another type of bias, we certainly want to have a diverse group of individuals looking at those simulations before we have that presented to students.
Do you find that that's an effective strategy to bring students into the conversation with you? Like, do you embed that student perspective as an executive director over academic nursing programs? How are you involving students in these conversations? Is that one of the, go-to approaches that you have to make sure that you're kind of pulse checking and seeing how information is landing?
I would say that from a course feedback perspective, we do take course feedback very seriously. So whether that be real time at the end of a course session or at the end of semester evaluation, and then looking at ways that we can improve upon that, obviously those are ongoing discussions with the faculty.
Well, I think that's a great approach, right? It sounds like having students as key stakeholders in the conversation has really been an essential piece for you. I will say I still feel like I am lacking so much information to at least be able to like manage the conversation. I look at somebody like you with so much experience and understanding in this. As other faculty, do you recommend that there are certain either programs or trainings or areas you think we should all be looking into so that way we can, embed this into our common language every day? Like, where should I go so I can understand more and be better at what we do?
Yeah, well, one of my go-to books is How to Be an Inclusive Leader, and that's by Jennifer Brown. In that book, there's an inclusive leader assessment, which I recommend, and it will tell you where you are in your inclusive leadership journey. And really, when we think about inclusive leadership, what Jennifer says is that it's this idea of creating environments where everyone can thrive and reach their full potential. So we want everyone to thrive, to experience belonging, and then ultimately achieve self-actualization when we think about Maslow's hierarchy of needs. So that's the goal. And, I think that that type of approach is paramount with our students, with members of the healthcare workforce. How do we set people up for success, regardless of where they come from, wherever they are at the moment? How do we help them get to wherever it is that they want to go? So that book, I think, is an essential resource, along with other tools, the implicit association tests.
I love that you're like listing all the books that I'm like, yeah, he's got them all on lockdown. But those
Yeah.
are really the resources that you've been looking at to kind of expand your expertise in this area. Now that you are looking and you're very much involved, and I think at the forefront of these conversations, what do you see that long term or even short term? What does that future look like to you for inclusivity and belonging? Where do you think we need to really be moving forward, especially since there are criticisms out there in the community right now? How are you addressing those and keeping, the profession moving forward?
Yeah, so I've been saying for a long time that inclusion and belonging, it's not about race or gender, which is what we tend to hear people talking about most recently. It's looking at inclusion more broadly. And my favorite definition of inclusion comes from the AACU, and they talk about inclusion being the active, intentional, and ongoing engagement with diversity in ways that increase our cognitive sophistication and understanding of the complex ways individuals interact within systems and institutions. And that's a long definition, but what I really like about it is that it talks about the engagement with diversity being active, intentional, and ongoing. So this isn't a one and done type of scenario when we think about our work as inclusive leaders. It is a lifelong endeavor to understand the complexity in the human experience and differences in the human experience. And those conversations are different now than they were 20 years ago. They will be different another 20 years from now, hopefully. We should continue to evolve and hopefully engage in more deep and meaningful conversations related to this work and in new areas. So it's important that we're constantly evolving, constantly challenging ourselves. And I think that that is the new direction, is to understand the full spectrum of the human experience, to understand difference in all of its forms, whether that be in terms of faith and religious traditions, or because someone served in the military, or because someone happens to love another person of the same gender, right? There's so many different ways that we bring difference to the table, and our engagement with that difference is what it's all about. How can we continue to expand that and to become more inclusive and to support people in reaching their full potential?
Well, and hopefully we can maintain that human-centered approach, right? As humans, how can we be better for one another and grow that within one another? And I think that's an incredible definition, and I love the active engagement as we should be growing and having these conversations within the community. Dr. Davis, I am so incredibly appreciative of all the information you bring to the table, and I'm just humbled by all of the work that you're doing to expand the belonging both for myself, the patients that I care for, and the community and family I very much am ingrained in. So thank you for that. Are there any last pieces of advice, especially for our future nurses who have a similar passion for you? Maybe they are struggling to have these conversations. They want to grow this work at their own institutions. Any pieces of advice you would give them so that we can continue this in a larger scope? How can we make their passions continue to ignite and grow?
Yeah, I would say that one of the most important elements of this work is being able to be comfortable in moments that are not necessarily comfortable, right? So finding comfort in the discomfort and being able to be in spaces that are gray, where you know that you're on a journey, but you're not there yet. And it might take a long time to get to this ideal or preferred future that's more inclusive, where everyone can experience belonging. That's probably going to be a never-ending ideal. Just like we say that, as a country, that we seek to become a more perfect union. We recognize that the union is not perfect, nor will it ever be, but we're always seeking to perfect it. And I think the same is true with regard to inclusive excellence. And as I mentioned, the work is active, intentional, and ongoing. The same holds true for us, keeping in mind that we will never reach perfection, but we're constantly moving in the right direction, that we're on track in terms of our mission. And the other thing I think that's important to keep in mind is that progress may not always be linear, that we may be trying things out and testing out different approaches, and we might not get it right. And so how do we correct for that? How do we acknowledge that we didn't get things right at that moment, and then work towards restorative justice and moving in the right direction?
No, I think that's incredible. And it's taking those accomplishments, right? They may seem small, but they really are the steps forward, as you speak about, especially as we're growing this and really creating the mission at an institutional level for many of us that are passionate about this work. For those who want to continue to see your work and see how you continue to grow, or want to get into contact with you to see how they can expand or know more about your institution at Georgetown, what is the best way for individuals to get a hold of you, or to reach out to you, or to watch your work grow?
Sure. Yeah. All you need to do is just, if you do a quick search, Stephan Davis, Georgetown University School of Nursing, my faculty profile will come up. Please feel free to email me, connect with me on LinkedIn. My LinkedIn handle is Dr. Stephan Davis, and I would be happy to connect with you. So thank you for that.
Thank you so much, Dr. Davis. Thank you so much for everybody who listened in today. I will say I always appreciate these conversations because I want to know more. I want to know more for the communities that we take care of. I want all of us to be able to expand and grow so we can have some better healthcare outcomes. Thank you again, Dr. Davis. For any of those who want to like, share, love, please list any comments or anything else you'd like to see as you're listening to our podcast. But I hope everybody has a wonderful day, and thank you again, Dr. Davis, for being here.